Friends, today we will discuss about different type of shadow patterns seen in cholelithiasis. Let us discuss about shadow patterns and wall echo shadow, that is WESH. There are three type of shadow patterns seen in gallstone disease. Those are: first, clean shadow; second, confluent shadow; third, wall echo shadow, that is WES or WESH. Again I am telling, there are three type of shadow patterns seen in cholelithiasis. Those are clean shadow, confluent shadow and wall echo shadow. Three patterns of shadowings are seen in gallstone diseases. First, clean shadow is for solitary stone. That means clean shadow is seen in case of solitary stone. Confluent shadowing is seen in case of multiple small stone. Wall echo shadow is seen in case of gallbladder filled with gallstone. Again I am telling, clean shadow is for solitary stone. Confluent shadowing is for multiple small stone. WESH, that is wall echo shadow, is for gallbladder filled with gallstone. One point you have to remember, all gallstone have shadow except soft pigment stone. Soft pigment stone may not have shadow. Let us discuss about clean shadow. What do you mean by clean shadow? This slide shows single clean shadow is for solitary gallbladder stone. This slide again shows single clean shadow is for solitary gallbladder stone. Let us discuss about confluent shadow. That means, what do you mean by confluent shadowing? Confluent shadowing means merging of shadows, which are seen in case of multiple gallbladder stone. When multiple stones are present inside gallbladder, these may produce multiple shadows just posterior to it. This shadow may merge. These are confluent shadowing. Again I am telling, confluent shadow is for multiple gallbladder stone. This slide shows multiple merged posterior shadow which are produced due to multiple stones are present inside gallbladder. Let us discuss about wall echo shadow, that is WESH. What do you mean by wall echo shadow? WES, WESH. WESH triad or WESH sign is seen in case of gallbladder filled with multiple gallstone, or when gallbladder packed with multiple stone and lumen cannot be appreciated. WESH triad or WESH complex have three features. First, two parallel hypoechoic line. Second, these two parallel hypoechoic line is separated by a hypoechoic interface. Third, presence of distal acoustic shadow or posterior acoustic shadow. Again I am telling, WESH complex or WESH triad means two parallel hypoechoic line is separated by a hypoechoic interface having a posterior acoustic shadow. One point you have to remember, when air is present in gallbladder wall, it will confuse with waste. Air in gallbladder wall will produce a dirty shadow, so normal wall is not seen. Waste triad or waste complex is seen in case of gallbladder filled with multiple gallstone, or gallbladder packed with stone and lumen cannot be appreciated. Waste triad have three features. First, two hypoechoic line. Second, two hypoechoic line is separated by a hypoechoic interface. Third, posterior acoustic shadow. Upper hypoechoic line is formed by gallbladder wall itself. Lower hypoechoic line is formed by multiple pegged stone inside gallbladder, and hypoechoic interface is formed by muscular layer of gallbladder and bile inside. Due to presence of multiple gallbladder pegged stone, it produces posterior acoustic shadow. This is waste complex or waste triad. In waste triad, there are two parallel hypoechoic line. Upper hypoechoic line is due to gallbladder wall itself. Lower hypoechoic line is due to multiple pegged stone. These two parallel hypoechoic line is separated by a hypoechoic interface. This hypoechoic line is formed by muscular layer of gallbladder and bile inside. Third point is that due to presence of multiple pegged stones inside gallbladder, it produces a posterior acoustic shadow. See the slide having two parallel hypoechoic line is separated by a hypoechoic interface having a posterior acoustic shadow. This is waste complex or waste triad. This slide shows two parallel hypoechoic line having a hypoechoic interface with a posterior acoustic shadow. This slide again showing two parallel hypoechoic line having a hypoechoic interface with a posterior acoustic shadow. Out of the two hypoechoic line, upper hypoechoic line is formed by gallbladder wall itself, and lower hypoechoic line is formed by multiple pegged stone inside gallbladder. This hypoechoic space is formed by muscular layer of gallbladder and bile inside. Due to presence of multiple pegged stones inside gallbladder, it produces a posterior shadow, that means posterior acoustic shadow. These are the three features of triad, that is waste triad. See the slide having three features, that means two hypoechoic line is separated by a hypoechoic interface having a posterior acoustic shadow. See the slide having waste triad due to gallbladder filled with multiple gallstone. There are certain conditions which are confuses with recognizing waste complex in ultrasound examination. Those are: first, overlying bowel loops; second, porcelain gallbladder; third, thickened falciparum ligament; fourth, gallbladder bed after cholecystectomy. These are the four conditions which are confuses with waste complex in ultrasound examination. Thank you. Thanks for watching.